Independent medical exam, mental disorders. This audio video was prepared to inform you about the importance of psychological examinations. If you are a client applying for Social Security disability, Veterans disability, long-term disability, workers' compensation, state retirement disability, or if you have a personal injury case and one of your impairments is due to suffering from psychological damage, the best way to document that damage is to attend a psychological examination. Psychologists use different tests to find out if you are disabled. Questions are asked about history, symptoms, signs, and limitations. For example, if you suffer from PTSD, also known as post-traumatic stress disorder, the psychologist must determine if you have experienced all of the following. You experienced the death of another or threatened death, serious injury or violence, flashbacks or ongoing thoughts or dreams of these events. You take action to avoid these thoughts or reminders of these events. Your mood or behavior is disturbed by these events. And you have sleep disturbance or you become startled more than normal. No matter what your diagnosis is, whether it is PTSD, depression, bipolar, anxiety, etc., if you have marked and/or extreme limits in certain activities, it may warrant a finding of disability. These activity limitations include an extreme limitation of 1 or marked limitation of 2 of the following mental activities. For example, you have difficulty understanding, remembering, or applying information or work instructions, difficulty interacting with others, difficulty concentrating, persisting at a task, or maintaining the level of pace at a task, difficulty making changes in behavior or managing oneself. What is an extreme limitation and what is a marked limitation? They are rating scales. Doctors determine what % of the workday a person's limitations will affect work. For example, the word marked could mean between 65% to 89% of an 8-hour workday, or the equivalent of between 5 hours and 7 hours out of an 8-hour workday. Extreme limitation means between 90% to 100% of an 8-hour workday. It is basically equivalent to the meaning of the word constant. Describe how long your symptoms last. If you do not have any of the above, you may still qualify for disability benefits if you have a mental disorder that is serious and persistent. In other words, you have medical records showing the mental disorder existed over a period of at least 2 years, and there is evidence of both medical treatment, mental health therapy, psychological support, or a highly structured setting that is ongoing and that diminishes the symptoms and signs of your mental disorder, and minimal capacity to make a change in your behavior. Note that the above criteria also apply to the diagnoses of depression, bipolar disorder, anxiety, schizophrenia, and organic or neurocognitive disorders. Therefore, I will not repeat these criteria when talking about the symptoms or signs of these diagnoses. Disability affects daily functioning. If you do have these limitations, you may automatically be found disabled. However, if you do not have these limitations, a more detailed analysis of your ability to function at work must be done. I will talk about this more detailed analysis at the end of this video. If you are claiming disability due to depression, you will be evaluated to determine if you have at least 5 of the following criteria for depression: depressed mood, loss of interest in almost all activities, appetite changes with change in weight, problems with either emotional distress or restlessness, for example, pacing around a room, chewing of the skin around fingernails, lips, tearing of the skin to the point of bleeding, or similar behaviors. Or there may be a slowing down or not performing basic life activities. For example, taking a shower, dressing, doing dishes, or cooking. Problems sleeping, decreased energy, feelings of guilt or worthlessness, difficulty concentrating or thinking, or thoughts of death or suicide. Don't fear describing symptoms in detail. If you suffer from bipolar disorders, you will be evaluated to see if you have at least 3 of the following: talking that is rapid, talking that is difficult to interrupt, irrelevant, loud, and without pauses, rapid changing of your ideas, thoughts, or subjects, inflated self-esteem, for example, an irrational belief that you are capable of doing things that you are not capable of, and this could result in activities that harm you, decreased need for sleep, and distractibility. If you are being evaluated because of a diagnosis of anxiety or obsessive compulsive disorders, the psychologist will need to determine if you meet the following criteria. You have anxiety that is documented in at least 3 of the following: restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, or sleep disturbance. Describe frequency of panic attacks and/or fears. Panic disorder or phobias is characterized by one or both of the following: panic attacks followed by a persistent concern or worry about additional panic attacks or their consequences, or disproportionate fear or anxiety about at least 2 different situations. In other words, using public transportation, being in a crowd, being in a line, being outside your home, and being in open spaces. Obsessive compulsive disorder is characterized by one or both of the following: uncontrolled, time-consuming preoccupation with unwanted thoughts, or repetitive behaviors aimed at reducing anxiety. Describe your inability to control your behavior. If you have an eating disorder, the psychologist will evaluate whether or not you have a persistent alteration in eating or eating-related behavior that results in a change in consumption or absorption of food and that significantly impairs physical or psychological health, and an extreme limitation of 1 or marked limitation of 2 of the following mental activities. For example, you have difficulty understanding, remembering, or applying information or work instructions, difficulty interacting with others, and difficulty concentrating, persisting at a task, or maintaining the level of pace at a task, difficulty making changes in behavior or managing oneself. If you are being evaluated for attention deficit type disorders, also known as neurodevelopment disorders, the psychologist will test to determine if you have one or both of the following: frequent distractibility, difficulty keeping attention, and difficulty organizing tasks, or hyperactive and impulsive behavior. In other words, difficulty remaining seated, talking excessively, difficulty waiting, appearing restless, or behaving as if being driven by a motor. And you will need to demonstrate either significant difficulties learning and academic skills, or recurrent motor movement. In other words, tic or spasm-like movements or vocal outbursts. Extreme limitation of 1 or marked limitation of 2 of the following of mental functioning. If you are being evaluated by the psychologist because you have an organic mental impairment, also known as a neurocognitive disorder, that typically includes some brain damage, the psychologist will be testing you to determine if you meet the criteria as follows. Describe your decline in mental functioning. Documentation of a significant decline in memory and thinking from a prior level of functioning on one or more of the following cognitive areas as follows: attention, learning new information, remembering it and retrieving it, language, perceptual motor, in other words, skills needed to perform athletic activities and interact with the environment, or social cognition, meaning processing information. If you are being evaluated by the psychologist for schizophrenia or other psychotic disorders, you will be tested to determine if you have any of the following: delusions, in other words, believing you are tormented, tricked, spied on, ridiculed, or hallucinations, in other words, hearing voices and seeing things that are not really there, disorganized thinking or speech, in other words, thought not connected or related to each other, or catatonia, in other words, lack of expression, movement, or activity. When you can't control your impulses, describe the frequency. Describe how the condition affects interacting with people. If you are being evaluated by the psychologist because the doctor is trying to determine if you meet the criteria for personality disorder or impulse control disorders, the psychologist will test and evaluate you to determine if you have any of the following. Continuous pattern of one or more of the following. Distrust and suspiciousness of others, detachment from social relationships, disregard for and violation of the rights of others, unstable interpersonal relationships, excessive emotionality and attention-seeking, feelings of inadequacy, excessive need to be taken care of, preoccupation with perfectionism and orderliness, or recurrent, impulsive, aggressive behavioral outbursts. Describe the frequency of each decline in functioning. As I stated previously, if the above criteria is not met, in other words, if you do not have either a marked or an extreme limitation, your decline in functional capacity from marked to a lower level of moderate, and sometimes mild, may result in a finding of disability and inability to engage in substantial gainful work if it reduces the number of jobs that would be available to you. The degree of impairments is most important. Using the scale that we talked about before, a moderate impairment that interferes with a work performance is between 34 to 65% of an 8-hour workday. And it may, all by itself, prevent performance of full-time work. 34 to 65% is approximately 2.72 hours to 5.2 hours of an 8-hour workday. When judges determine the extent of your functional limitations, they must carefully perform a more detailed analysis of each one of the 4 broad categories of understanding, remembering, or applying information, interacting with others, concentrating, persisting, or maintaining pace, changing behavior, or managing oneself. Functional capacity will be analyzed. We will therefore need to take each one of these 4 categories and assess it in more detail. For example, understanding and remembering includes the ability to remember locations and work-like procedures, understanding and remembering very short and simple instructions, understanding and remembering detailed instructions. Interacting with others includes interacting appropriately with the general public, asking simple questions or requesting assistance, accepting instructions and responding appropriately to criticism from supervisors, getting along with coworkers or peers without distracting them or exhibiting behavioral extremes, maintaining socially appropriate behavior and adhering to basic standards of neatness and cleanliness. An ability to concentrate and persist is most important. Concentration, persisting, and maintaining pace may include carrying out very short and simple instructions, detailed instructions, maintaining attention and concentration for extended periods, performing activities within a schedule, maintaining regular attendance, and be punctual within customary tolerances, sustaining an ordinary routine without special supervision, working in coordination with or proximity to others without being distracted by them, making simple work-related decisions, and ability to complete a normal workday and work week without interruptions from psychologically based symptoms, and to perform it at a consistent pace without an unreasonable number and length of rest periods. Adapting or changing behavior and managing oneself may include the ability to respond appropriately to changes in the work setting, ability to be aware of normal hazards and take appropriate precautions, ability to travel in unfamiliar places or use public transportation, ability to set realistic goals or make plans independently of others. The doctor must fill out our rating forms. Make sure you ask your attorney for the form. There is a special form that is a questionnaire that we will provide to all claimants undergoing psychological evaluations. This form must be given to the doctor conducting the psychological evaluation. Ask your attorney for this form, and when completed by the doctor, it will be sent to the judge or decision maker on your case. Thank you for watching this audio video on independent medical exams for mental disorders. We hope that by watching this you are now more prepared for your examination.